Hey folks, good morning. We're at Circuit World here in Blue Ridge, Georgia. Beautiful Friday morning in North Georgia here. I'm your host, BKP, and with us this morning, it is time for Ask the Doc. We want to thank Georgia Cancer Research Center affiliated with Northside Hospital for this segment. And I want to thank Dr. William Whaley here with us this morning. Now, you know, we have been talking. Have we been talking since January, February?
January. Remember when I said there's a new virus in Wuhan, China, that they don't understand. That I think was the second week in January.
We have been talking about this. We have been bringing updates. We've had doctors from Atlanta, Dr. Stephen Marlowe. We have in depth every week kept you informed. These doctors have, and I appreciate them, and there's no difference this morning because what we want to cover, as you well know, we don't want to say COVID's back in the news, but COVID is back in the news a different way. Dr. Whaley's going to take over here in just a second, and we're just going to green light whatever direction he wants to go in because we're hearing increased hospitalizations. We're hearing increased percentage of death, increased cases, different hot spots throughout the country, and we are going into winter. But we also have gotten some great news about a vaccine. So he's going to wrap all that up together, and he knows the direction he wants to go. Dr. Whaley, I told you when you started, I know you have to go to work. He goes to work he has to go to work.
Well, first of all, it's a 10 today, 5% chance of rain.
Yes.
It's going to be absolutely gorgeous. And if you ride a motorcycle, if you play golf, if you walk in the woods, if you want to go to an orchard or anything, come to North Georgia this weekend. It's going to be fabulous until Monday.
You're exactly right.
And we're still 20 inches up in rain, and the tide doesn't mean anything today.
It's just a nice tide.
Okay, now, here's the thing. I believe that we have been given credit over the last 6 months or longer with bringing things to this program that are in the news weeks later. I mean, I've gotten so many emails, he's gotten so many emails that we heard it here first. One of the things he'll talk about in the political program was everybody joked that the coronavirus is going to go away on election night. It hasn't gone away on election night. Lonnie, show that COVID map, that little sign there I don't know how much you can read on television, but if you go to the New York Times daily COVID report over the last 48 hours, the number of cases, over the last 2 weeks, that's the right-hand side of this curve, cases in the United States have increased by 72% over the amount that they were doing 4 weeks ago. Now, 72% is a real number. Hospitalizations have gone up 39%. Some of your expert panel people have always said, well, cases are just positive tests. That's exactly true. So that doesn't mean sick people. That just means positive tests. Hospitalizations, that's sick people. When somebody has a COVID virus, when they have symptoms, they go to the doctor, they're short of breath, they make the diagnosis, their temperature's 101, they don't hospitalize them, they send them home. And they only come back to the hospital for hospitalization when they are having shortness of breath or symptoms that have to be medically intervened upon. So the hospitalization rate has gone up by 39%. So that tells you that most of the new cases, the 72%, are just positive tests. Now, the people that are on your expert panel also say, don't tell me about hospitalizations, tell me about deaths. Deaths are up 33%. But that's 33% over the 2 weeks that are 4 weeks and 3 weeks ago. And the death rate from this virus is going down every week. I keep saying the death rate's going down. The people that are getting hospitalized have a much better chance of being discharged from the hospital. So all of the publicity now talking about shutting down the country, talking about in New York State and in, I think, California, that you can't have, if you're going to have a family over, you got to do your entertaining in your yard. You can't you take the mask off to eat. You can go to a bathroom in the house, but every person that goes to the bathroom, after they leave, they got to re-clean the bathroom. I mean, that's some really serious stuff they're talking about because of these numbers. Okay, pull that one down. Nobody's interested in the United States as a whole. They're interested in where we are and where we live. So this next one, this is about 3 days old, but the death rate in Georgia, let's see, this would have been Wednesday. The total death rate total number of deaths was 88,500, and the total number of cases was about right at 400,000. It's now like 430,000. And in Fannin County, we'll use that at the top, there have been 36 deaths. Now, that's not an insignificant number of deaths in a county with about 18 or 20,000 people, and there have been right at now 900 to 950 cases. So you can pull that down. So the media, I don't want to use the media, the health experts that you see on television, the talking heads, and the ones if Steve Marlowe was on television, Steve Marlowe would say, stay 6 feet, wear your mask, wash your hands, and do these things that we've been talking about for 6 months. And then the people who want to argue about whether or not that's authoritarian, telling you how to live, or come up with some sort of study that says we're exhaling 2 quarts of water every day and your mask becomes ineffective after a while. We have gone through all of those arguments here over time about the mask. So on Thursday afternoon, put up that one about the CDC. Everybody that talked about this, from the liberal CNBC down to whatever that Blaze is on the other end, said the CDC has waffled again. And then this is the headline from Thursday. CDC, here are the key words, now says masks protect both the wearers and those around them from COVID-19. It had only been a week ago and 8 months ago that the CDC made the admonition that you're wearing that mask to protect you, not me. Do you remember that? And we had some arguments with that over time, because I had said, I think there's good evidence, and this evidence I'm going to show again. When you first saw here 6 weeks ago, that we knew that the mask in some regard protected the wearer as well as the rest of the public. Show that next one there. This is the graphic that came out with that statement 2 days ago, and it says, my mask protects you and your mask protects me. That concept, I think we said here 8 weeks ago, was true, and then within weeks after that, the CDC said no, it's the other way around. Pull that one down, and now you're used to seeing this. You remember this one? This is the hairdresser model. Lonnie, you remember that? Okay, this came out. I'm gonna see if I can find a date on it. This came out like in June. 2 hairstylists spent at least 15 minutes with 139 clients. That's the graph. The 2 hairstylists were both COVID positive at the time and did not recognize it. And the number of infected people that they infected out of that 139 clients was 1. So that's 138 people that did not get infected from the hairdressers who were wearing their masks. You can pull that down now, Lonnie. So that's evidence then that the mask, in at least some extent, protects the public as well as the wearer. Now, this is where Ray got in all the time to talking about the N95 mask and does it fit well and everything. There's different kinds of masks. If you'll remember, that N95 mask, we're not going to show that picture today, but that N95 mask is the one that your carpenter or the guy that comes into your house doing industrial work is wearing to protect himself from particulate matter in the air, and we've been seeing those for years. That's the real mask. Well, people aren't liking them. They're low supply. They're not called masks. They're called respirators, and they're difficult to find. They're not very comfortable. And so when we talk about masks in the general public, we're talking about that paper mask that looks like the operating room, or we're talking about the homemade cloth mask, which work pretty well, and we're not talking about the gaiter that you pull up over your nose. Now, here are a couple of things that are extremely important that are out of the news. Yesterday, the New England Journal of Medicine published what I think are very, very important articles, because if you want to know who can control your behavior, Lonnie, who can control groups of behavior better than anybody else? Marines. All right. So there ain't no doubt about that. And where can they control them better than anywhere else? Boot camp. All right.
So we're calling in the Marines.
We're calling in the Marines. And here is a study that was reported yesterday. A whole group of Marines, I think the number's like 1,978 or something, who are entering boot camp a couple of months ago, all voluntarily isolated at home for 2 weeks before they came to Parris Island. When they arrived at Parris Island, they quarantined for a second 2 weeks. So that's 4 weeks of quarantine, and they are all negative. They're negative by definition because of 4 weeks of quarantine. Now, all of their training is outdoors, and indoors they all wore masks. They had them generally one to a room rather than two. Some they had two, and they ate socially distanced. They were socially distanced all of the time, wearing their masks, and lo and behold, they infected the number I've forgotten, 78 or 88 or something, but they had infections from all of these non-infected people because one person apparently turned positive after the 14 days of quarantine, and nobody knows where he got it unless he got it from a coin in a coin machine or something. And that they passed it in two environments. One was in the social space of the dormitory where they were all close together and not out of doors, and that wearing the mask did not stop, in other words, it's not 100%, did not stop that virus from passing among these very heavily quarantined Marines. Now, published at about the same time was the final report on the USS Roosevelt. You remember the captain of the Roosevelt got booted because his ship got overwhelmed by the coronavirus. It wasn't his fault at all. They now know in retrospect it had nothing to do with what he did or didn't do. There were 4,779 crewmen on the Roosevelt. 1,271 turned positive before they got everybody off the ship. Of that 1,271, 43% were just like us. They had absolutely no symptoms. Only 23 of that 1,271 got hospitalized. Now remember, this is back in February, March, early in the virus, when we didn't know as much about it as we know now. Of that 23 that got hospitalized, 4 went in the ICU, and 1 died. So the fatality rate in those Marines back in the early days was less than 1 in 1,271. That wouldn't have happened now because of our new, how much we now know about treating the virus. But so what this is what this I think emphasizes is, one, Marines, healthy young people who are not sick, are passing the virus to one another, and that's what people have been telling you. That's the reason that the older people, our fine china, have to be careful about having asymptomatic young people come around them. Second, there's no doubt that wearing that mask to some extent or other helps prevent you from passing the virus to somebody else, and probably lowers by 20 or 40% the chances that you're going to get the virus. So it encourages people to wear the mask when they're in the Walmart and when they're everywhere else. Jane asked me last night, well, does Mama have to wear it? She's 92, when she's walking on the streets of Blue Ridge. And I said, well, Jane, if the streets are crowded, the answer is yes. Because if there's a group in front of her that are talking to each other and she walks through their air in the next 15 seconds, that stuff can still be there. She's out there by herself, heck no, throw the mask away. So that's this CDC coming out with this thing a few days ago created a tremendous amount of discussion. I don't think there was anything new in what they said. I think what the problem is that there are just too many people that are issuing pronouncements. I mean, it's almost like, you remember the article at Delphi? We ought to have somebody up here. Every pronouncement needs to come from the oracle at Delphi. If it was going to be me, I'd put Steve Marlowe up there and let everybody submit what they want to say to Dr. Marlowe, and then they get him to approve it. So anyway, that gets you that far. We're going to come back into what the next big step is. So I think what we really established right here is the virus is on the rise. It's on the rise in young people. The treatments are much more effective. The virus is on the rise. The hospitalizations as a percentage of the number of people that have the virus is going to be what it is. But the death rate in those people is falling because we're doing a great job of treating it.
Well, let me ask this, because I know there's other areas you want to go into, and I think there's.
It's your turn. No, you got to tell me what.
Well, I think there's two things. There's a couple things that people are asking. Okay, we're in November. We're in the holiday season coming up, where the two biggest times of the year, I would say, for family and friends together are Thanksgiving and Christmas. Is coming up. Thanksgiving, we have a mayor of Chicago that is basically shutting down Thanksgiving. 10 people in a gathering. What would you recommend for our Thanksgiving Day? I mean, just be candid. What would you recommend? I mean, because, this is the only time, and please forgive me, Uncle Joe. I don't know why I'm picking, but this is the only time you get, crazy Uncle Joe to the house and you get to ask him questions. You can't wait. I'm sorry, Uncle Joe, but you know what I mean. I mean, this is the one time where those people, and also Christmas. So what do you say about Thanksgiving? Because I have seen, personally at my house, I've seen 40, 50 people. I mean, we've had like 3 kiddie tables and the tradition.
Okay,
I'll leave it there. It's just I said enough. What would you say?
I believe that the Thanksgiving family get together should continue. You may want to modify it, and that your cousin from Kentucky does not come this year, because you don't know what your cousin and his family from Kentucky are like. But let's take us. We got 3 grandkids and a family in Atlanta that we see at least once or twice a month. They're very careful,
right. And I know them.
Yeah,
yes,
and right, they've been on your show,
yes.
and we expect them to come up here, and we expect Jane's mother's 92. We expect that those boys will be up here with them, and that they're going to wear their mask, and that when we're together and eating, we're going to be eating, and Mimi's going to be at one end of the table, and the kids are going to be at the other. We're going to all be in there together. So, but we're not going to have the Philadelphia family and the New York family come down here to be with us, if that makes any sense. Second,
it does. No, that does make sense, because it does.
All right. So the family is together. those two families in Philadelphia and New York can be together, but they won't be coming here. Some Thanksgivings have been multi-family, and I think these, if you listen carefully to what they've said about these onerous recommendations, are that if you have have it outdoors, remember you can only be there for 2 hours. They said less than 3 families.
Right.
Less than 3 families. Well, that's bringing multiple families together. It sounds like the neighborhood sort of a thing. And less than 50 people. Well, I think that's probably not terribly wise. And if it's better off if you try to keep the group small. So if you had a family that had 50 people in Philadelphia or wherever it was, and they all came from New Jersey and everything else in the past, I think this year you'd put it off. Interestingly, Fauci said yesterday that we're going to be doing this into 2022. So when you say this, this is this year. Next year it might be a little less strict, but I've said before, the fact that the vaccine's going to be here, which is where we're going to go next, the fact that the vaccine's going to be here, and everybody thinks that announcement about the vaccine is sort of like dipping Lazarus in the blood and we can get working. That thing's not going to get started till February or March, and you're going to have to immunize 80% of the country before you start tamping the virus down. And I had said before that you'll be wearing a mask next summer. I think that you'll probably be less restricted in the fall of next year, but it's not unlikely that we'll have some of these restrictions that go into 2022.
So when we say recommendations, obviously, you're out there, you're going to do what you want to do, but where it comes to Thanksgiving, family from multiple states that you don't know their day-to-day work environment where they're working, right, and you don't know the people that they're with.
Plus, they're going to be traveling to you.
Plus, they're going to be traveling, right? So don't end Thanksgiving. Don't say you're not having Thanksgiving. But I'll just give you an example. Like, we're here in Georgia, but where my mom is at, there's my sister is right there. My other sister, my brother, and their kids. So they interact daily. So and they're right there, so that's fine.
And then, and they can get together with the other. This is at this generation. There's some at that generation. They can bring them in there, and then if they've got some 20s, they wear their masks.
Let me ask you one more question, because now we're going into holidays. Okay, again, with the holiday question, and then we'll double back. We want to hear about the vaccine.
Okay.
But the other question I have that I've been hearing is, you've traveled all over the world. I remember wanting to go to Africa, getting a list of all the shots they wanted me to have to go to Africa, And I remember just even going to Australia some years ago, getting a list from the State Department of what, you need to have this shot, this shot, this shot, That being said, we've been used to our State Department giving us international travel advisories. But now we have state-to-state travel advisories.
Oh, yeah.
What say you on these states that are starting to say, if you traveled from here, you've got to quarantine 14 days, and if you've traveled from there and stopped in this state or whatever, air travel, bus, cars, stopping on the way to grandma's house over the river and through the woods. What say you on some of these travel advisories?
I think it's past my level of expertise, but this past summer, as you'll recall, my family meets at the beach for a family week, and my Atlanta family drove to Avon by the Sea, New Jersey, and New Jersey had a quarantine rule that if you came from, I've forgotten what states it was, North Carolina or something, that you had to quarantine when you came into New Jersey. So what they did was they drove straight through the state. They got to gas before they entered the state and didn't stop and bought their gas on a few states up the road to try and adhere to the rule. Nobody adheres to those rules. They don't stop you when you come into the state and check your driver's license and then put you in a hotel and check you every day. I think most of those recommendations that they make are for show. They don't really do anything. If people have that told to them, they may say, I don't really need to go up to New York right now, and so I'll stay home. But it's not going to change the way people, a lot of people work, because they don't. There's no way to enforce it, and there's no way to check that people are doing it.
All right, I appreciate you. I
it's
just
outside my area of expertise.
I know people out there are hearing that in the recommendations in the media out there, so I appreciate you touching on that. I know you want to talk about the vaccine.
I want to talk about the vaccine. I got a couple of things about the vaccine, but one of them I want to talk about is I want to mention what everybody thinks is political about the vaccine, and say that there may be some truth to the fact that there was political slowing of the announcing of the vaccine. I mean, you've heard that they could have announced that the vaccine was here in the middle of October.
Yes.
Which would have then been a win for Trump if they had done so. So put up that first
a win for him in the sense that he was actually he was being honest with the American people,
yes,
that it was on its way.
Yes.
Yes, I see what you're saying.
All right, show that first one. All right, so Pfizer is the company, you can pull that down now, that has come up with this vaccine. And that we've been through this. Show that next one there. We have been through this many, many times, but this is sort of the ladder of how you go about getting a vaccine from we want to invent the vaccine to we want to use it. And up here at the top is where you get you see where you get FDA World
Right,
Health.
and I always want to double back, folks. Right here on this show, Dr. Whaley told you on this show alone, Warp Speed, that the mumps, 4 years. That one stuck with me.
Right. Okay.
That took 4 years to develop.
Yes.
Right.
And that was the fastest one. Now this right here is the normal cycle, and this
right.
Normal cycle is 8 years.
Exactly.
8 years. Okay, this thing all begins in January, and this and pull that down before we go to this. And that was this. So January is when this business all starts, and mid-October, which is 10 months later, they had proof that this vaccine works. You with me?
Mm-hmm.
Mid-October. Now, they haven't announced it yet, have they? Okay, show up this next one, because I think this is really important. Pull up that one, because we're going to look at your copy of it, which is better than mine. All right, yeah, that's better than mine. Okay. Now, these are the various kinds of vaccine. We've gone through this before, but messenger RNA is the animal, or is the thing that the Pfizer vaccine has its immunity against. All right, pull that down. Remember, I've said before, there has never been a messenger RNA vaccine released for use in the world. Number one. So this is a totally new type of vaccine. So what they've done, and this is how the study was done, I'm going to come to where I think the politics may have come into. 44,000 people were given the shot, and then given the second shot 1 month later. The statistical analysis said that when 22 people out of this 44,000 have been shown to be COVID virus positive, you can then determine, so nobody in the world, the patient, the person who gave the shot, the company that manufactured it, the doctor's office they got it, knew whether they got the shot or they got the salt water, the placebo. Now that's a big deal. Totally blinded. Nobody knows. You with me?
Mm-hmm.
So when 22 cases have occurred, they will then unblind those 22. Well, we know from what was published that vaccine was 90% or better effective, which means out of if it was 20 people, not 22, that meant 2 got the virus, and 18 didn't. And that was a huge success. It was what we would call in a cancer study the first break point. That generally would have been announced to the public. At first analysis, this vaccine appears to be effective at 90%. That was available in mid-October. Here's what Pfizer said. After consultation with the FDA, it was decided to wait to break point 2 before the announcement was made. So they had to wait from the 22 positives till they got up to, I think the next break point was in the 43, 47 positive or something. And that took up another couple of weeks and was available, the day after they declared that Biden was the president, 5th, 6th, or 7th, or something like that. So what was the reason that the FDA and Pfizer decided not to report the first break point, but report the second break point? I don't know the answer to that question, but that was 43 cases, and now it's up to 97 cases. So you're through, I think, most of what you would consider to be the fundamentals, and that the 90% number is still there.
So you're saying the positive news was out there and should have been available, and forget. And
I
I'm
didn't say should. I said the word could.
Could have been.
There's
Could
a
have been.
difference.
Okay. But let me say this:
if it was a cancer trial, I want to stick to what I know.
Okay.
If it was a cancer trial at the first statistical break point, if there was a national meeting, some guy would have presented a poster or a 5-minute talk that this clinical trial, which is not concluded, seems to have positive data at the first statistical break point. And second, there are no adverse indicators, meaning nobody got, you know how they stopped those clinical trials, those people got sick.
And I'll go with that.
The
so
word
what
is
I guess
could, not should.
All right. Well, so could have. So what I want to say here is, forget for just a second there was an election. Erase that out of your mind. There was a time before November 3rd, there could have been positive reporting that was out there, regardless of what's going on over here.
It would have been probably the 15th to the 20th of October.
Okay, I get it. All right. What else you got?
Well, I know you got your expert panel coming around. Your reduced expert panel. This is a very alarming statistic in my mind, because you don't have to be studying this very much to know. You don't think you can turn on television without knowing that many places in the country today have an inadequate number of nurses and technicians available in the hospitals to care for these patients. You know, I think El Paso, Texas, and Texas is the great example today that they've set up. Remember back when we had the hospital ships in New York, they're setting up rooms in tents outside El Paso hospitals. It was estimated there 74 million. Look at that number. That's about how many people voted for Mr. Trump. 74 million U.S. workers are at high risk for the COVID virus. 74 million. If you take all of the healthcare professionals that are involved in the treatment, including the people that are delivering equipment to hospitals and cleaning hospitals and everything else, and the people that live in the house with them. See, that's a multiplier. It's a huge multiplier, right? So, there's 3 of us here, but how many people do we live with? That's multiply. I mean, I'm living right now with 4. Sometimes I'm living with 7. But if you take the healthcare professionals, including the people that deliver, the guys that drive the ambulances, the first responders, the police, the fire, and everybody else that's at the front line of the COVID virus epidemic, and then add to it the people that they live with and are closely associated with, that's 74 million people. And 61% of them either have weight, blood pressure, age, or some, quote, premorbid condition. So that's why they say we have to protect our healthcare workers first. And now that we have the vaccine, who should get it first? Well, obviously, the healthcare worker should get it first so he doesn't take it home, and the nursing home patients should get it first because they're the most vulnerable. Well, that leaves you and Lonnie out, doesn't it? It gets it to me, but it leaves you and Lonnie out. Y'all don't get the virus. You don't get to do it. So the idea that this vaccine available in February is going to just clean everybody up is ludicrous. Now, how much do you know about the vaccine and its storage?
I don't.
Okay. Well, this has been well publicized, but people don't listen to it. It has to be kept at 71 degrees below zero.
Wow. No, I missed that.
From its manufacture until its administration. Now, that's cold storage. So they have to create a huge number of 18-wheelers or airplanes or coolers that can go in the back of trucks that are cooled to numbers we aren't used to seeing. I mean, dry ice at the market's not at that temperature.
Right.
So this is a whole infrastructure that will be required if the Pfizer vaccine happens to be the best. Now, there are 15 other vaccines that are at this point in the pipeline that if they are 90% effective, some of them just have to be kept cold. So this may not even be the vaccine that comes to the market because of this difficulty with getting it from where you made it to Blue Ridge, Georgia, where you can give it to somebody and keep it 74 degrees below zero the whole entire time. So I mean,
there's quite an undertaking.
There's quite an undertaking,
and the fact that distribution of this vaccine.
Right, and the fact that the vaccine's out there is wonderful. The fact that the vaccine can get, but the infrastructure and stuff to get you there is huge.
Folks, we always want to thank Georgia Cancer Research affiliated with Northside Hospital for this segment. We appreciate them very much. We appreciate Dr. Whaley studying this and you know, I'll just say if you'd see the emails going back and forth with his colleagues, that there's a lot of information and he keeps up with. I got to thank you for that. I read the emails throughout the week. You, Dr. Marlowe, several others. And cutting edge stuff right here. We appreciate it. Let me just say this, okay? There's a couple other things that you're hearing in the media, but I like to say let it flush itself out of the system before we jump into it and not get into it. You're hearing a possible coming mandated quarantine, possible national mandate. That's possible. You're hearing a possible national mandated, mask. Those are things. Let's let them get through the system. Let's see what reality they may be, and we will promise you right here on this show, the doctors will look into that and they will report on that. So if you're hearing that and wondering why we're not addressing that, we're going to let that get through the media for a week or two before we jump into that and try to address that. I thank you so much for addressing the vaccine and where we're at now and our holiday plans this season, Dr. Whaley. He's got to go to work. He always has to rush out and get to work, this guy. He's always working. We appreciate you. Northside, North Georgia Cancer Research, Northside Hospital, we appreciate you very much. Always go and find these segments on FYNTV.com, FYNTV.com, under Ask the Doc. Then also go and find these segments on our YouTube channel, FYNTV, Fetch Your News. It's our YouTube channel, playlist Ask the Doc. And then, if you ever have questions concerning this or anything for the doctor, send them to us. Find us on social media or send them to us. Email info at FetchYourNews.com and put in the line there, subject Ask the Doc. You have a great day. We'll be right back. We're going to break down some of this and some political. We're going to analyze what's going on in Georgia as far as the Senate races. We're going to really get into that next. Take a break, Lonnie.